Thank you all for joining us today, September the 7th, for a COVID-19 update. First, before I turn things over to Dr. Fitzgerald, I wanted to thank every Newfoundlander and Labradorian who has rolled up their sleeve and got the vaccine. Vaccines work, and we need everyone to continue to do their part to get our rates of vaccinations even higher. I know there are some people out there who are still skeptical about the vaccine. They think that there may be problems or maybe fake news. Well, let me ask you one simple question. How many people do you know with smallpox? I can tell you right now, the answer is not only for you, but indeed for every person around the world, no one, because vaccines work. We need you to do your part to continue to get our numbers where they need to be to continue with a safe, productive economy. Now, if you won't do it for that simple reason that science works, please consider your neighbors, your communities, those who can't get vaccinated, like children under 12. Please do it for them, to keep them safe, to allow them to go to school and so that they can reach their full potential. So please do your part and get vaccinated. It's the simplest thing we can do to get ourselves out of this pandemic. Speaking of vaccinations, I'd like to also take the opportunity today to inform people that we will be moving towards a COVID-19 vaccine passport. A few weeks ago, I asked Minister Hogan, Minister Haggie, and Minister responsible for Services and L to continue to work towards a vaccine passport. After doing a jurisdictional scan, we have come back with a reasonable alternative for our province, and that is adapting something similar to what's happening in Quebec. A Quebec model will be introduced here within the oncoming weeks to month. Now, will be a little bit different in that we will be using this as a tool in a toolbox. Quebec has a very different epidemiological status than we do here in St. John's and around the province right now. So we want to make sure that we have a robust toolbox enabling us to deploy different tools when required based on the science and the epidemiology. So that is an important step that we will take to ensure that people who do have the vaccine and have done their part will not be penalized should certain outbreaks occur across our province. Of course, tomorrow is the first day of school. I know my family's excited to get back to school in what has been a very challenging series of months and years. Please, again, do your part, get vaccinated to protect those schools. And to the teachers and students who have endured a long, long series of months, please try to enjoy and learn. You are the future. And to the teachers and those staffs working in the schools, please continue to do your best to keep our children safe as we all collectively work to that same goal. With that, I'll turn things over now to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone, and thanks for being here with us today. Since the last public advisory, which was yesterday, we have 5 new confirmed cases of COVID-19, all in the Labrador-Grenfell Health Region. The breakdown of these cases is as follows: 1 male between 40 and 49, 2 females between 50 and 59, 1 male between 60 and 69, and 1 female between 60 and 69. All of these cases are contacts of previous, 4 of these cases are contacts of previous known cases, while 1 is under investigation. There are 7 presumptive positive cases as well today, 2 in the Western Health Region and 5 in the Labrador-Grenfell Health Region. There have been 3 new recoveries, leaving 35 active cases in the province, and there is 1 person in hospital because of COVID-19. A total of 276,955 tests have been completed to date, and the total number of cases in our province is now 1,511. As indicated yesterday, there is a cluster of cases emerging in the Labrador-Grenfell Health Region. As of now, there are 8 cases associated with this particular cluster, and the investigation involves a large number of contacts, and the source of the cluster is under investigation. As a result, Public Health recommended the delayed opening of 3 schools on the Northern Peninsula to allow time for contact tracing. This includes Cloud River Academy in Roddickton, H.D. Fillier Academy in Angley, and Mary Sims Allgrade in Mainbrook. We have been and will continue to consult with the Department of Education and the Newfoundland and Labrador English School District and we thank them for working together with us to ensure the safety of our students and staff in the area. Effective immediately, a special measures order is being introduced to move several towns and communities on the Northern Peninsula East region to Alert Level 3, and it will include a requirement for wearing masks in all indoor public spaces. The towns and communities include Roddickton, Bide Arm, Englee, Conch, Croke, St. Julian's, and Mainbrook. The rationale for this decision includes several factors. We are continuing to find cases in all groups of contacts indicating community spread. There are several large gatherings implicated in the investigation, leading to large numbers of high-risk contacts. The outbreak is related to the highly infectious Delta variant, and most importantly, there is a low vaccination rate in communities in the area. The investigation into a small cluster in the Western Health region is ongoing, and there are 7 confirmed cases of COVID-19 connected with this cluster. The identified cases associated with the cluster are isolating, and contact tracing is continuing. The source remains under investigation. The investigation is also ongoing into a small cluster of cases in the Eastern Health region, and there are 5 confirmed cases connected to this cluster. Contact tracing by public health is done, and the risk to the public is low at this time. Anyone considered a close contact has been advised regarding quarantine according to current guidelines. The source of this cluster is also still under investigation. There have been some questions lately about the vaccination status of recent cases. There were 125 cases reported publicly from July 1st to September 7th. 49 of those were cases associated with out-of-province ships and have been excluded from our analysis. And of the 76 remaining cases, 28 were fully vaccinated, 12 were partially vaccinated, and 36 were not vaccinated. Recent clusters and the increase in COVID-19 cases have heightened people's anxiety, and it's going to be an adjustment for all of us to learn to live with COVID-19. As I've said before, the goal is not to stop cases from coming into the province. Cases will come through travel, and we need to realize that this is part of living with COVID-19. But our goal is to find a way to live with it, and we can do this in 2 ways. 1, by increasing our vaccination rate, and 2, by practicing our tried and true public health measures. Every vaccination administered reduces the risk of a 4th wave coming to this province this fall. Over 86% of the eligible population have received their first dose, while over 76% have received their second. And I thank everyone in Newfoundland and Labrador for stepping up to do your part to help reduce the risk of COVID-19. Making the choice to receive the COVID-19 vaccine protects you from COVID and protects your loved ones and those around you and in your community. The more people we have vaccinated against this virus, the better protected we all are, and there is strength in numbers. High vaccination rates is key to protecting people from severe illness, ending the crisis phase of the pandemic, and helping everyone return to normal activities. One of these normal activities is the return to school tomorrow, and the back-to-school plan developed by the Department of Education and the school districts includes public health guidance for both low-risk and high-risk scenarios. Thankfully, the majority of students in our province will return to a low-risk environment. Public Health maintains regular communications with the Department of Education and the school districts, and if the situation changes, make no doubt that we are prepared to take action and move quickly to keep our staff and children safe. This was clearly shown yesterday when it came to the situation on the Northern Peninsula. Rest assured that if the epidemiology and evidence warrants a change in guidance for schools on a regional or provincial basis, we will not hesitate to take action and do what we need to do to protect our students, staff, and communities. Those of us that can be vaccinated need to build that barrier to protect those who cannot be vaccinated, particularly those under the age of 12. And I've said it before that it's possible we will be into late 2021 or even 2022 before a vaccine is available for children under 12. And that's why it's so important for parents, guardians, and eligible siblings for those under 12 to get their vaccinations, as well as students 12 years of age and older, and those at our post-secondary institutions. If you are an eligible student or a parent or guardian of a student that has not yet been vaccinated, please do not delay that first dose. If you are able to get your second dose, please do so and complete the series to build your immunity. If you have questions or concerns about the vaccine, please turn to the right sources for answers. You can speak with a healthcare provider such as your family doctor, a pharmacist, or a public health nurse. Children and youth may come across false information online related to COVID-19 that can be harmful. So please talk with your children about what they are reading and watching and help them understand information sources that are credible. Starting a new school year can be exciting and stressful all at the same time, and it's normal to feel this way, especially with COVID-19 still being a part of our lives. So if you need to talk to someone about how you're feeling, reach out and share your concerns with a trusted confidant, a parent, your teacher or guidance counselor, or your friends. And you can also check out the free e-mental health services for youth and adults available at bridgethegap.ca. These services can help build effective coping skills and positive behaviors for the school year ahead. From a computer, tablet, or cell phone, people can instantly access content that can provide advice, assurance, or guidance on finding additional supports when and where needed. We are all in this together, so remember to be kind to one another and keep doing your part to follow public health measures. So with all of that said, we still need to be careful. COVID-19 is not gone, it is still here, and we must keep practicing our tried and true public health measures, including wearing your mask in indoor spaces, washing your hands often and well, physical distancing, and avoid hugging or shaking hands with those who are not your close contacts. Most importantly, stay home if you are sick, or if your child has symptoms, keep them home. Anyone in the province, regardless of their vaccination status, should get tested if they are experiencing even just one symptom of COVID-19. Do not assume it's just a cold. There has been community spread and outbreaks across the country because people were mildly symptomatic and did not get tested or limit their activity. It is essential to find any cases of COVID-19 so that public health can do their job effectively and contain the spread of the virus as much as possible. As a recap for those of you just joining, since last public advisory, we've had 5 new confirmed cases of COVID-19, and the total number of cases in our province is now 1,511. You know what to do, and you have the know-how to prevent the spread of COVID-19. I'm incredibly proud of the determination that you have shown throughout this pandemic, and I know that that determination will see us through to the end. I ask for your continued cooperation and adherence to public health guidance in the coming months as we embark on the new normal and learn to live with COVID-19. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. I'll turn things over now to Minister Haggie for some brief remarks.
Thank you very much, Premier. The holiday weekend has just passed. It's the last holiday of the summer. Unfortunately for some in communicable disease nurses and public health officials, there wasn't much of a break this weekend, and I'd just like to give them a shout out for all their hard work while some of us were perhaps trying to sit at home and have a fire or something. Contact tracing is seizing a lot of people's time and effort, and the entire regional health authority system has offered Labrador-Grenfell in particular support. There is a way each of you can do your part to help with that, and that is to download and use the COVID Alert app. Nothing leaves your phone, it is safe and secure, and will save a lot of people hours on the back end should you be exposed. As of September the 9th, as part of our attempt to make our vaccination records as complete as possible, we will have a mechanism for those of you who received vaccinations out of the province to be able to get documentation from the province here to support that. So what you will require for that is a valid MCP card and the record of vaccination from your out-of-province provider. This you will then upload into a portal. The process by which you would get a validated document from the Newfoundland and Labrador healthcare system will take around 2 weeks. The website will go live and should be available to you on Friday morning of this week. In the short and medium term, this will have to be an initiative that you drive as the mechanisms for collecting that data electronically from other jurisdictions are not developed enough yet for us to do this automatically. In context of recent developments in the province, there are a whole series of exposure notifications that have been placed online over the course of the last few days, and I would encourage you to access those if you feel you may have been in those areas. I would like to repeat Dr. Fitzgerald's comments about the presence of a symptom off the COVID-19 list. If you have one, stay home, get tested. Don't assume that it is simply the runny nose for the start of going back to work or the end of the holidays. Getting the shot is the one thing that those of you who haven't can do. And we have seen now how a low prevalence of vaccination, low uptake of vaccine in communities can impact the measures that we are going to have to take to try and control the spread of this disease. So the clinics are there. They are posted regularly by each of the regional health authorities, and I would encourage you all to take advantage of it now. With the vaccine record coming later on in the year, there may be occasions where things you might want to do will be contingent on having a vaccination. Those are things for the future, as the Premier said, tools in our toolbox. So I'll close now, Premier, by just repeating the message that Dr. Fitzgerald has given, and yourself: get the shot. Thank you very much.
Well, thank you, Minister. We'll open it up now for questions.
Thank you, Premier. For the benefit of our speakers, we have 1 media in person and 3 joining by phone. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. As students look to go back to school tomorrow and we're seeing a rise in cases, hearing from a lot of parents wondering if masks will be implemented once again for the school year.
So certainly at the moment, the majority of the province will be looking at a low-risk situation. I mean, we do have some small outbreaks in Eastern, but at the moment, and Western, but you know, the biggest area of concern is what we announced today. You know, we're going to continue to look at the evidence. We've always said that we'll be looking at everything, and a lot of discussions are still happening. So I guess stay tuned to this station.
Thank you. And also another question that we're getting a lot of inquiries on: as our cases rise and we know that the vaccine isn't 100% effective, some of its benefits are to keep you out of hospital. Many people wondering how many breakthrough cases we do have in the province.
So we have seen a number of breakthrough cases, and just if you can bear with me for 1 second, I may actually have that information right here. At the moment, let me see. Yeah, so those 14 days after dose 2, which is what we would consider, so since the beginning of our vaccine program, which would have been December 16th, we've had 31 full breakthrough cases.
But I think it's
out of 1,150, sorry.
Yeah, and it's worth noting that hospitalizations are not directly related to any of those, correct?
No, as far as I know, no.
Okay. So you're 36 more times likely to be admitted to hospital if you get COVID-19 and you don't have a vaccine than if you do. So again, further evidence of the benefits of a vaccine.
We will now go to the phone. Our next question is from Meg Roberts with CBC. Please go ahead.
I was wondering what the vaccination rate in Roddickton is. As we're hearing, it's under 60%.
So we don't have the vaccine rate for each individual community, but we will say in that area, that is correct, that it is under 60%.
And, you know, future lockdowns possible, where do you stand on that? Do you see us going into that kind of situation, you know, in the upcoming months?
So I think, you know, our goal is to avoid that at all costs. And certainly I think we see when you have you have a significant proportion of the population that's unvaccinated, how different the spread can be as compared to situations when you have a significant proportion of the at-risk population who are vaccinated. And we've seen that in like the clusters that we had in Eastern, you know, where we had a few cases at the beginning, and then there wasn't a lot of spread because we had a high vaccination rate in those at-risk, the populations that were at risk or that were exposed in the beginning. So, you know, I think the evidence is quite clear that even though You can still get infected when you have the vaccine, 2 doses of the vaccine. You're less likely to spread it. You're far less likely to get seriously ill and end up in hospital. As opposed to a situation where we're seeing a large proportion of the population that's unvaccinated, especially with this Delta variant. If it gets into a situation, where we have the majority of people unvaccinated in an enclosed space, in close quarters, not wearing masks, it's going to spread very, very quickly.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I'm not sure who wants to take this question, but the fallout of the George Street Festival this year seems to be that there are no consequences for flagrant violations of pandemic measures. No one seemed to take responsibility for it, either the people who held it or any department of government. What message does that send, do you think?
I think, Peter, we have a complaints-driven process. A posting on Facebook doesn't constitute one. My understanding is that prior to the weekend, I was not aware of any complaints through our line. They would then be handed off to whichever jurisdiction was appropriate. So law enforcement, Service NL, GGSNL, in the case of an establishment with a license to serve food, and the Newfoundland and Labrador Liquor Corporation. The facts of the case is that they had a plan, and the plan on paper was vetted by public health and advice provided to them, and they were under instructions to follow it. We have, as yet, in my department, not had any formal complaints or allegations that this was not the case.
Okay, thank you. In terms of the taking firm action, if you bring in the vaccine mandates and passports, there's a potential for a kind of a violent reaction from those who simply don't understand vaccines. Is the government considering taking more strict targeted measures to avoid any kinds of conflicts that this might create?
Well, I think introducing vaccine passports to be utilized when the evidence and the epidemiology would support is a good thing that will nudge people towards making the right decision to protect themselves, the economy, and their communities. This is not a decision that we take lightly, and it's something certainly that in the balance of freedoms, we'd certainly put time restrictions on. But it will allow, should another wave occur, like in certain areas around the province that may have lower vaccination rates, the economy, the businesses to stay open and frankly to not penalize those who have made the right choice, the educated choice to get a vaccine. So of course, we see that there is some angst about the vaccines, but I again repeat my initial comments. Vaccines work. They work for smallpox. They work for polio. They've been one of the best inventions humankind has ever created in terms of our longevity and our ability to continue despite these microbacterial infections. So, there will always be some resistance to whatever you do, and certainly no vaccine campaign is always perfect, but we certainly will be taking the measures when appropriate to make sure that we hit the highest rates of vaccination in our province to protect our communities.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. With schools opening tomorrow, do we have any updated numbers or stats on how many young people between 12 and 18 years old have been vaccinated in this province?
Sure. At the moment, at the provincial level, between 12 and 19 is what our cutoff is. We have just about 70% of those people are fully vaccinated, and about 84% have received at least one dose of the vaccine. This was as of day before yesterday, I think.
which is an excellent start.
Thank you. And jumping off of Peter's question a little bit, why did we decide to go with the Quebec model for vaccine passports, and how do you envision them being used in this province?
Well, after we did a jurisdictional scan, this seemed to be the best model to move forward with instead of trying to recreate the wheel. It certainly seemed to be the one that had been piloted, tested, and had what we believe to be the best security available. So that's why that model was chosen. Of course, the federal government is still working towards one, and we believe that their passport will have to communicate with the provinces. So in ensuring that ours is similar to others will certainly allow and afford for a more synergistic approach there as well. But we kind of looked across the country, and again, instead of recreating the wheel, using another wheel, we felt that Quebec had done a good job in developing theirs. It's as simple as that.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. Also on the vaccine passport front, obviously this is still in the works as it's being rolled out. But are we looking at a QR code? Are we looking at a printed form, knowing that not everyone has a smartphone or cell access in this province?
Sure, it's QR based, similar in Quebec, with the ability to print and then scan should you not have access. And we are looking at recognizing that not everybody has access to those devices and ability to print that on a card. The nice thing about this system is it does not rely on, is my understanding, on full connectivity. It lives on the device, and so you will be able to use it without having Wi-Fi availability.
And how do you see employers enforcing this for businesses to go in and out of what the measures will be, or how people will access exemptions?
So exemptions for medical reasons will be buried in the device. So my understanding of the Quebec is screen, and Minister, you can weigh in here. It reads it, and then it'll either give a red or a green code. And so, if you have a medical exemption, allergies, subsequent poor reactions to vaccines, what have you, then it would still come up green.
The Registrar of the College of Physicians and Surgeons is in the process of preparing a guideline document for physicians who may be asked to provide medical exemptions, and there will be criteria and recommendations there, and that will be out in time for the launch of this system.
Our next questions are from Meg Roberts with CBC. Please go ahead.
You mentioned wearing masks inside as a way to build barriers, Dr. Fitzgerald, and that those in the Northern Peninsula should now be wearing masks indoors. Will you be bringing back a province-wide mask mandate, and are you strongly suggested people wear masks?
Yeah, so, I mean, I've strongly suggested, or not suggested, but strongly recommended that people wear masks even from the time that we took the mask mandate out. That is still public health's recommendation, is that we wear a mask when indoors, especially in crowded spaces. And right now, as part of the level 3, going to level 3, that will include a mask mandate for that area on the Northern Peninsula. With regard to province-wide, we're having conversations. We're trying to make decisions based on what we're seeing happening elsewhere in the country, what we're seeing happening with the Delta variant, what we know is happening, what the evidence is showing us. So we're looking at all of that, and as we've said many, many times, if the evidence tells us we need to move to that direction, then that will be we'll certainly won't hesitate to do so.
Safe to say the best way to keep the mask off is to get the shot in, though, all the same.
Thank you.
Do you have a follow-up, Meg?
Nope, that's it.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Given the number of breakthrough cases, which is much higher than any previous vaccine trials would have suggested, do you feel the likelihood of reaching anything resembling herd immunity is a bit of a pipe dream, or is that something that we will eventually see, do you think?
So I think eventually we can get to herd immunity. I mean, there are lots of vaccines that, may not prevent you from contracting disease, but prevent you from getting severely ill, right? And that's what we're looking at with this. So while these breakthrough cases can happen, people generally are not ending up in hospital or not ending up severely ill. So that's still very, very important when we're talking about a disease like this. So I think, you know, obviously herd immunity is not something we can think of until we can get children under the age of 12 vaccinated, because we have a significant proportion of the herd that can't get a vaccine. You can't get herd immunity. But what we can get is somewhere very close to that. If we can get, you know, close to 90% of the eligible population vaccinated even before we think about vaccinating kids under 12, that still provides an incredible level of protection to the community and to those children. We know that people who can't get vaccinated for many different reasons are protected when we have significant proportions of the population that are vaccinated, because the disease has nowhere to go, really. So it's really important for all of us to step up, those of us who are eligible for the vaccine, to step up and get 2 doses and become fully vaccinated.
Okay, thank you. And I'm wondering if the province is still conducting wastewater tests and where those would be taking place.
Yeah, we are still doing wastewater testing. In fact, week before last, I don't know, time is blending together, but we did have a notification that we had a high confidence result in Paradise, and we were asking people in Paradise with symptoms to get tested. So we are still working on wastewater. We're hoping to expand it a little bit further. Right now we're having St. John's, Paradise, CBS. We have a site at Memorial using wastewater testing there, as well as in Gander. And we're working to increase the number of communities across the province and into Labrador as well.
Just for clarification, the subsequent test in Paradise came back okay, correct?
It came back low, yeah.
Okay, yeah, I assumed that because there wasn't a report afterwards. Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. It's been said that this cluster of cases on the Northern Peninsula, that there's a large number of contacts involved. I wonder if you can give us an idea of just how many contacts we're talking about here. What's the scope that public health is dealing with?
At the moment, we are talking, I think, somewhere between 230 and 250 contacts that they're dealing with at the moment. There's a couple of large gatherings in there, as well as a larger workplace. So yeah, it's and people are generally speaking, people are having lots of contacts with others now, lots of close contacts. So it does put us. It's a challenge for the public health in Labrador-Grenfell region to look at that number, right? I mean, public health staff is done by population, so even though 250 may not seem like a lot in Eastern Health terms, in Labrador-Grenfell Health, that's a lot of contacts to have to be traced by their public health team, who are doing a phenomenal job, I have to say. After this weekend, it's incredible the amount of work that they have done to put up vaccination clinics, to put up testing clinics. It's just incredible. And once again, has been proven many times throughout this pandemic, the teams in the regional health authorities have risen to the challenge, and they're just an incredible bunch of people. I'm so proud and privileged to say that they're my colleagues.
And keeping with that cluster on the Northern Peninsula, it was mentioned in your earlier comments that this is being driven by the Delta variant. Are all of the cases that we're seeing in the province now associated with the Delta variant?
Yeah, any that we have been able to subtype, because there are some that, you're not able to do that, have been Delta. Since, I can't tell you exactly how far back that goes, but it's certainly been in the last month, everything has been Delta.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us. Certainly want to echo my colleagues' appreciation for the people in Lab Grenfell and Western Health for working hard on Labor Day weekend to ensure the safety of people in that part of the province. And again, encourage everyone to get vaccinated. It is the best thing we can possibly do to get ourselves out of this pandemic. We are getting there. We're very close, but we need everyone to push a little bit harder. Please, I encourage you all, get educated when it comes to vaccines. They work. They have worked for quite some time, and they will work for you in your communities. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.